PhD 122 Drug Discovery Challenge. Hi everyone, today we will be presenting on Neurorestin, a medication that shows promise in the treatment of epilepsy and chronic pain. Our target disorder is peripheral neuropathy. Neurorestin is inspired from Neurontin drug. This presentation will explore more about Neurorestin. Understanding this mechanism helps us explain how Neurorestin works to control seizures and reduce nerve-related pain.
Okay, now let's start with the drug name and class. First, the drug name is Neurorestin. Second, there are two classes, which is therapeutic class and pharmacologic class. For the therapeutic class, Neurorestin is in anticonvulsant or anti-epileptic class. And for the pharmacologic class, Neurorestin is in gamma-aminobutyric acid or GABA analog class.
Our drug Neurorestin works by targeting a receptor called trimamycin receptor kinase B, TRKB. This receptor is normally activated by a natural protein in the body called brain-derived neuropathic factor, BDNF. BDNF help nerve cell growth, survive and repair by themselves. Neurorestin act like BDNF and activate TRKB. This activation help damage nerve cell growth back and work properly. Although Neurorestin does not directly act on enzyme, it starts a chain reaction inside the cell. This activates important enzymes such as PI3K and protein kinase B. These enzymes support nerve repair and reduce inflammation. In summary, our product, Neurorestin, help improve nerve health by turning on the right signal through its action on TRKB.
Next, expected therapeutic effect. First, anticonvulsant. It is an adjunct treatment to treat partial seizures. It can reduce calcium influx and reduce abnormal neuronal electrical activity. Second, neuropathic pain relief. It can decrease pain signals like glutamate and substance P. It relieves burning or tingling pain because of nerve damage. Third, fibromyalgia. Central sensitivity is decreased in the spinal cord. Fourth, restless leg syndrome. Abnormal nerve signals are regulated in the spinal cord to reduce uncomfortable leg sensation. Next, mechanism of action. Neurorestin appears to reduce the release of excitatory brain signal in the presynaptic area that contribute to seizures by showing a strong attraction to binding site in the brain that match with voltage-gated calcium channel, especially the alpha-beta-delta-1 type. This subunit help move calcium channel parts from inside the cell to the nerve ending. Studies suggest that alpha to delta subunit levels can increase during long-term pain, and that this change is linked to increased sensitivity to pain. When Neurorestin blocks the alpha to delta 1 subunits, fewer calcium channels are present at the nerve ending, and fewer excitatory signals are released. Neurorestin's anti-seizure effect is likely caused by this blocking action.
Drug development consideration. Preclinical studies. First, animal models. Uses of streptozotocin induced diabetic neuropathy mice. Second, biomarkers. It can downregulate the activated microglia or inflammation marker. Clinical trial plan. There are 3 phases. Phase 1, to ensure tolerability and safety. Phase 2, to ensure efficacy and dose optimization. And Phase 3, to make comparison and real-world use. Drug concept, mechanism and clinical benefit. The drug concept is oral therapeutic agent that improves peripheral neuropathy treatment. One of the mechanism is tropomyosin receptor kinase B stimulation. And one of the clinical benefit is. Next, let's take a look at adverse drug effects. First, occasional headache and mild nausea, but only less than 5% patients experience this side effect. Patients should avoid consuming any other strong CNS depressants while taking Neurorestin. Second adverse drug effect is low possibility experiencing sleep disturbances, and it actually happens if high dose taken. Patients should start consume Neurorestin with low dose and titrate it gradually.
Expected effect on disorder. First, promote nerve regeneration. Second, reduce neuropathic pain. Third, inhibit neuroinflammation. Fourth, improve sensory and motor function.
Impact on future treatment landscape. First, chronic pain management. Neurorestin can be used as non-opiate option for chronic disease. It's also useful for neuropathic pain, fibromyalgia, and post-surgical pain. Second, mental health expansion. Neurorestin is useful and studied for anxiety, PTSD, and bipolar disorder. It can also become a potential alternative to replace benzodiazepines. Third, personalized dosing and monitoring. It's emphasized on dose adjustment in kidney patients, and is also AI-driven and gene-based dosing tools emerging. Lastly, it can be combined therapy. In future, Neurorestin may be combined with other drugs for multi-treatment options such as cancer. Summary: Neurorestin is a medicine mainly used to treat seizures and nerve pain. It belongs to the anticonvulsant drug classes. It can be taken by mouth in the form of tablet, capsule, or liquid. The common side effect by taking this drug
on
is
disorder.
feeling sleepy,
First,
dizzy,
promote nerve
swelling in night,
regeneration.
tiredness.
Second,
For
reduce
patient counseling
neuropathic
point,
pain.
people with kidney
Third,
problem
inhibit
may need a dose
neuroinflammation.
adjustment,
Fourth,
and you
improve
cannot
sensory
take this
and
drug
motor
with another
function.
drug, or it can cause a drowsiness. That's all from us. Thank you.